Hey guys, let's finish up our respiratory lecture by talking about environmental lung disease. And then we'll have some open-ended questions and some other things to consider. Let me make sure this is right. Okay. So environmental lung disease is a lot like COPD. So by the way, this is the end of my long lecture for lower respiratory, just that I've chopped up into smaller chunks to make it a little bit more manageable to swallow since there's so much content. Okay. Anyway, environmental lung disease is very similar to COPD. It's an inflammatory disorder and it's chronic. But it's related specifically to chemical exposure or dust. So the most important thing you're going to do here to differentiate environmental lung disease from COPD is look at their work history. So this is for those that have lived or worked in older buildings that might have asbestos in them. This is for coal workers that may have worked in mines and things like that, poor ventilation, lots of chemicals and things in the air, farmers working with pesticides. They're going to have a lot of similar symptoms, except for these patients, whereas COPD, it's kind of progressive, like where they start to feel some symptoms and it progresses and gets worse. A lot of people have no symptoms until 10 to 15 years later. It kind of just comes up. And it's not that it's like a sudden, like all of a sudden one day you have all of this, but they don't have symptoms right away. It looks a lot like COPD. They have dyspnea, can't breathe, they have wheezing, the weight loss, appetite issues, and they don't tolerate activity well. Overall, for this patient, the treatment is going to be very similar. They're going to need oxygen. They're going to need things like bronchodilators and other inhaled treatments. They're going to have issues with too much sputum or that thick sputum. So they're going to need the things like CPT or the chest percussion therapy or chest physiotherapy. And hydration is going to help to get those secretions up. But the biggest other thing that I want to do here is unlike, COPD, which, for some people it's genetic or, it's cigarette smoking, which we can prevent that. The bigger thing here is that environmental lung disease is almost 100% preventable if those that are working in places like farmers, coal workers. Now, those living in a building or working in a building with asbestos may not know it, but those that are working in places that they know they're coming into contact with chemicals, we need to teach them about protective equipment, about avoiding chemicals, and getting regular checkups in order to prevent this. So that's environmental lung disease. Now let's do some stuff to bring together lower respiratory. Like I said, it's always helpful after we go through a section, do some open-ended questions. So let's look at some of these. What are 5 priority teaching points for a client with asthma? So we talked about with asthma, asthma is a lot about preventing attacks. So 5 priority teaching points for me. First, I'm thinking this is an overreaction or allergy issue. So 1, definitely avoiding triggers. I know this patient has a lot of mucus. So another teaching point I would think of is that we want them to increase their fluids to thin out those secretions. So increase fluid intake. I would say knowing their peak flow readings and having an asthma action plan and understanding. I would want to teach them about an asthma action plan if they didn't already know about that, and that they should always be taking their maintenance medications. Medication compliance is so key. Even when they're feeling okay, they need to keep up with their medications because maybe they're feeling okay because they're taking their medications. I could also include things like decreasing stress, and can definitely make a difference for some patients. Like weight loss can help as well. I'm trying to think if there's other things I want to remember. Seek help early, don't wait till late. Because these attacks can definitely get very serious very fast. I think that's a lot of it. A lot of it's med compliance, avoiding triggers, increase your fluids, know your asthma action plan, know how to use your inhalers, and know how to check your peak flow and how to follow that asthma action plan after. Okay. So there's probably more, but that's off the top of my head that I could think of. And again, I'm not giving you the only correct answer. Please use your best judgment and your notes. Don't use these questions. Try to do them from your beautiful brain first, but then go back to your notes and see where we can fill in the gaps. So after starting an antibiotic, what are 3 priority assessments to see if the medication is working? So to see if this medicine is working, I would maybe want to look at, depending on, again, what kind of infection this is, probably we're talking about respiratory, lower respiratory. So I would say I would want to listen to their lung sounds to see if there's a difference in their lung sounds, I would want to look at their work of breathing and do a general respiratory assessment to see if it's getting better. And then I would think I would also want to look at maybe at their oxygenation, because if a respiratory infection is getting better, oxygenation should get better, work of breathing should get better, and lung sounds, if they are abnormal, should become clear. Those are probably going to be my top priority assessments. Now, some people might say white blood cell count, but that's more general. I always want to go to specific. I want to look at the patient, the end outcome, to see how things are better. If you're taking care of a patient with tuberculosis, what assessments findings would warrant a call to the physician? So tuberculosis, like I mentioned, like normally it's going to be pretty, like it's not going to be mild, but, there's not a whole lot of like life or death dyspnea, intubations with these patients all the time. Unless they're super sick, or their tuberculosis is super serious, and maybe it's spread, etc. But what I would think is, if tuberculosis is a respiratory problem, we talked about, they might be short of breath, they might have lack of appetite, they may need some oxygen. I would say I'm looking for their respiratory status to get worse, or their infection status to get worse. So I would say is if they have a new worsening fever, that just won't go away. If they had worsening shortness of breath, more oxygen requirements, like I'm needing to put them on more and more oxygen, using more of their muscles to breathe, oxygen saturations going down. Those are all the things I would think would warrant a call to the physician. So then I have my reminder here too, don't forget about the smaller disease processes. So like, for example, pleurisy, atelectasis, acute bronchitis, pleural effusion, you're going to be tested over thoracentesis and environmental lung disease. So these questions here, I'm not going to go through all of these, but take the time to go through. A lot of times students, they look at the blueprint and they just study the highest, or the ones that have the most questions, because they're like, oh, there's only one question for some of these. But if you have 7 disorders that each have 1 question, that's 7 questions. And that's like about halfway to failure if you miss all of those. So just know, with all of these, they may be small. You may not need to know as much about them, but you still, like, again, these small things can build up. So make sure you're taking the time. Definitely put your focus on COPD, asthma, pneumonia, and tuberculosis. Those are your top 4 for lower respiratory, but there's these other things mixed in there. So make sure you're studying them as well and understanding how they relate to these other ones. But these are just some questions to kind of start bringing things together. You also, if you're having trouble differentiating some of these, you could get a table and, I actually have some of these on my Google Drive. There's a table, and then it breaks down like how are each of these diseases or processes different. Or you could do a case study around them. I have a worksheet that has a bunch of different scenarios for each of these disorders, and you have to pick out what are the cues in the question that will tell, or in the story that's going to tell you that this is what it is. So definitely be like looking for, how am I going to see how these are different from each other as well. Anyway, that's it for now. I hope this helped. I'll see you for the next one.